Now, we need to know what's the weakest system. So the lowest of the systems, everybody will have one system that's a little bit lower than the rest. Okay, now the endocrine in this case is the lowest of the systems. Now when we see that in the male, we always have a look at the insulin levels. So I need a special filter here that will show us the deficiency in the insulin management, and the code for it is insulin def. So this is a specific filter for a deficiency in the blood sugars. So okay, so the patient would be down the road towards diabetes to some extent, and a lot of people are in that position, and a person who has a deficit of 8 out of 10 in the insulin management should treat themselves as if they were a diabetic. Okay, now that was the weakest system. So we're back again, and we're going to have a look at the worst stressed organ. Now this is technically the main damage. Okay, now the worst stressed organ there is the liver. So when we see the liver as the worst stressed organ, we always have a look at the congestion level. So I'm measuring it on a scale of 1 to 5 for congestion. So 0 out of 5. Okay, it's 3 out of 5. So there is a certain amount of congestion in the gallbladder there. It's measured at 3 out of 5. Now if it gets to 4 out of 5, the person needs a gallbladder flush to flush out the gallstones. Okay, now we have our worst stressed organ. So now we're going for our dominant focus. And this is technically where the immune system is most concerned. And again we get liver. So the liver is the worst stressed organ, the liver is the dominant focus, and the insulin is the weakest system. So we work quite often with a DNA sample from the patient. The patient's full energy field is in any DNA sample. In the case of the patient we're examining today, the vitality showed at 18 out of 25. Now this is his 5th visit. When he started, it was, I think, a 12. We got the endocrine system as the lowest of the systems, and then we looked at the insulin deficit, and we got an 80%. Now that patient needs to correct his diet. And then we looked at the worst stressed organ, and we found the liver. The congestion level in the gallbladder was 3 out of 5. So that person has a certain amount of grit and stones building up. And that 3 out of 5 represents the extent to which the liver is not dealing with all the work it has to do and should be doing. However, the dominant focus is also the liver. So the liver has a fairly high degree of toxicity. Now in this testing, we're dealing with a very, very sensitive membrane here, a test membrane. And when we are asking the questions through the filters, we get a yes or a no answer through the kinesiometer.